who has, as I said, been supportive of the group set up in Scotland, and has come along to talk to us today, principally, I think, on ocular surface disorders. What to a layman like me, I think that means is dry eyes and things that relate to it, but he will tell me if I'm wrong. And I hope he's going to say a word or two about Intax too, of which he has some experience and about which a lot of queries have been raised. So over to Dr. Ramaesh.
Thank you very much for inviting me. And I have a very soft voice, and I'm not a very good public speaker. So if you have any problem understanding, please raise your hands that I will understand and try to be more clear. Right. Now, this is a kind of an unusual topic, and why I choose this topic to address you. Now, as a physician or a person who's caring for the eyes, when I take the patients who have keratoconus, half the time I spend trying to solve problems which is arising from the conjunctiva and the lids, etc. And keratoconus is a problem with the cornea, but also the individuals who suffer from keratoconus will have problem because of some abnormalities of the ocular surface. So, and what is this ocular surface we are talking here? Right. Now, that's the cornea. That's the one which is causing problem because the shape has changed, become conical, and it's not focusing the light properly on the retina and causing problem with vision. But this structure is supported and protected by conjunctiva, which is covering the globe, and that is the inferior aspect of the globe. And it has a lid margins, and lid margins actually is a very complex apparatus, a complex tissue. It has eyelashes in it, which is prone to get infection. The roots of the eyelashes are prone to get infection. And it is supplied with a very rich gland, which produces an oily substance, what is known as the Meibomian glands. And this is a picture which we have managed to invert the lids, and it has an undersurface, and it's called the tarsal plate. Normally it's a kind of a fibrous tissue, tough tissue, which is very essential to protect the eye. So this cornea is protected, and the function of the cornea is facilitated by the structures around it. It's just a microscopic picture, and when there's an infection in the eye, you get lots of mucus coming, and that is a protective mechanism. And this mucus is also very essential to keep the eye wet. It's like applying soap when you're having a bath. It's like a surfactant. And this mucus is produced by the specialized structures called goblet cells. And all these are very essential for the proper function of vision, because you need the lacrimal gland to produce the tears. It should stick to the ocular surface, that is the cornea, for which you need the mucus, and the eye should be protected. You need the lids and the conjunctiva. So if there's any problem with any of these structures, you are going to have problem. Now, I have put dry eyes in the bottom because it is a problem in individuals who are suffering from keratoconus, but also you have lots of other problems due to eczema. I actually don't know the exact figures, how many people with keratoconus suffers from eczema, but it is a considerable number and it varies from region to region. We are conducting a study recently. Our figures are coming up to about 20%, but it may vary from region to region. It's a very important disease which affects the lid margins. This is a photograph taken from an individual who is suffering from keratoconus, and he is also a sufferer from eczema. And eczema can affect almost any part of the body, and it also affects the lid margins. Now, what happens when it affects the lid margins? The eczema not only affects the lid margins, and also it can affect the conjunctiva. So this disease is going to affect the lid margins, the glands, the surrounding skin, and the conjunctiva. Now we'll look one by one. Now, when the skin around is involved with eczema, you're going to have a scratching. It exudes serum. And that is a very good culture media for the common cell bacteria to grow. And you get a low-grade inflammation and infection. Now, and I also mentioned the lid margins are supplied with glands which produce sebum, an oily substance. And if you note this picture, there aren't any eyelashes here, because the chronic inflammation has destroyed all the eyelash roots and they have come out. And some of the bacteria which is living here, because of the compromised nature of the surface, infects the fat glands and all the meibomian glands. And there what they do is they digest the fat and release an acid, fatty acids, which can constantly pour into the eye. The fatty acids are not acidic in nature, but when they seep into the eye at a very slow rate, it causes a chronic irritation in the eye. That in turn aggravates the red eye, itching, and further compromises the surface of the cornea as well as the conjunctiva. Now, you can imagine the eye is already compromised. This individual has keratoconus. He cannot tolerate glasses because that doesn't help. And if you have to put a contact lens on top of it, no way. So one has to be aware that one has to deal with this problem first before you can comfortably fit a contact lens. Now, second thing, because of the nature of the disease, you are constantly doing something to the eye, not because you wanted to, because there's a need. You use contact lenses, you use contact lens solutions, and the eye is prone to allergy, injury, and a lot of people have dry eyes, therefore you use plenty of eye drops. And these are sources of an allergic agent going into the eye. For example, when you use lots of eye drops, when you have dry eyes, you want to use an artificial eye drops, which has lots of preservatives in it. Preservatives can irritate the eye. So that is one source of irritation, preservatives in these eye drops. Now, also, those people who suffer from keratoconus also suffer from hay fever and seasonal allergic conjunctivitis. And this is a season, again, starting for seasonal allergic conjunctivitis. Now, you're all right during the winter time, but summer comes, pollen count rises, and you end up with a seasonal allergic conjunctivitis or hay fever conjunctivitis. Then again, you're a comfortable contact lens wearer during the winter time. Summer comes, the contact lens fitting can become difficult. Now, what happens if you have allergic conjunctivitis? You want to use steroids. You want to use steroid eye drops. We'll talk about steroid eye drops. It has to be very cautiously used. Now, this is fortunately rare, but can occur in patients who are suffering eczema or soft contact lens wearers. You can see this gentleman came with severe red eyes, itching, and a lot of mucus discharge from the eye. Now, this is the lid margins which I have turned in, so everted. And under lower magnification, you can see the surface is not normal. The blood vessels are congested. And this is how it appears under slight high magnification. They appear like a cobblestone. And this is called giant papillary conjunctivitis. So you put the lid back, what happens? This is going to rub against the nice surface of the cornea, right? And when it rubs, each time you open and close the eye, it's going to take a layer of the front of the eye. And you may end up with defect in the front of the eye, or it leads to an epithelial defect on the cornea and can lead to corneal ulcers. Fortunately, this is uncommon, but it can happen. So, next problem. We all lead a busy life. Sometimes you go for a Saturday drink or Friday night out, and you forget to take the contact lens out. And if you are very careless, this is one of the problems you can get. You can end up with a corneal ulcer. Right. This is a true story of a young man who was energetic, active, but being a young male, more common in males, he left his contact lens for a few days. He didn't take it out, left it, and came back to the clinic with a painful red eye. And this is what we saw here. It's an ulcer. We have stained this ulcer with a special staining. It's a problem here. And another gentleman, a bit careless, you can see the nice cornea, but blood vessels are growing in here, and here's scarring here. Again, careless use of contact lenses. Now, briefly, I think I will talk about dry eyes here. Why do you get dry eyes? Again, you have three components to the tears. One is the watery substance, which comes from the lacrimal gland. Usually, it functions properly in people who have keratoconus, but the one which makes the aqueous or the water onto the eye surface is deficient, that is a mucus. So although you produce enough tears, that doesn't stick into the eye. The third reason is, if you use contact lenses for a long time, the corneal sensation declines, and you need a proper corneal sensation for the reflex arc to work. Then only the lacrimal gland can produce tears. So it's a kind of a cut down, a break in the nervous reflex. So combination of reasons, the loss of corneal sensation and loss of the surface integrity causes, and the chronic inflammation leads to dry eyes. Now, we cannot go into great details, but I thought these are some of the advice I used to give my patients, what they should not do rather than what they should do. Now, steroids. Now, when the moment you put steroids in the eye, you achieve a greater comfort in the eye. and you want to use it more, so you have a prescription, you go to the GP and ask for a repeat prescription. And you keep on using the steroid eye drops. It's not a very wise thing unless you're under close supervision. One, it compromises the defense system and can lead to ulcers in the cornea conjunctiva. All kind of infection, bacteria, herpes simplex, very common, and fungus. Amoebic ulcers are very uncommon, fortunately, these days. And also, this can lead to steroid-induced glaucoma. Steroids, glaucoma, think all the time. If you are going to use steroids without supervision, is it going more than 2-3 times a day for more than a month, you can go to the local opticians. They are very good at checking the pressure. You need a close supervision if you are using steroids. A lot of the patients I have to deal are related to steroids. Now, second caution is the preservatives in the eye drops. Now, these are toxic chemicals, but in very low concentration. Now, if you have a serious dry eyes, you'll be using drops, various preparations available, for more than 4 times a day. The general rule I use is if you are going to require any drop more than 6 times a day and for more than 2 months, I would recommend to my patients them to take preservative-free eye drops. Preservative-free eye drops are more expensive, but they are much better than the preserved eye drops. That is a kind of general rule. If you are going to use more than 6 times a day, more than 2 months, and also if you are suffering from eczema, and if you already have eczema-related eye diseases, better to go for preservative-free eye drops. Then contact lenses. Be sensible, is especially for the young male individuals. I'm not a sexist, but this is reality. Good care of the contact lenses. Contact lens solutions, they can get contaminated. And don't sleep with the contact lenses. It can seriously compromise the ocular surface. Then, you live with red eye, painful all the time. But if there is any symptoms, new or persisting, it's best to see eye specialist or a person who has experience in looking at the eyes. It need not to be an eye doctor, but lots of the opticians, the colleagues I have in Glasgow, they are very good at it. And usually they call me directly if they find anything and if they are unhappy about anything. So you must consult someone who can look at your eye and say, oh, this is not good. You must see somebody immediately. And how to deal with the dry eyes? Honestly, there is no real good answer because all the drops we have in the market does not simulate the function of the natural tears, because the natural tears have 3 components and all the artificial tears in the market has just 1 component, that is the aqueous only, the water only. You need the mucus, you need a bit of the fat layer. And if you go onto the internet, you'll get hundreds and hundreds of advertisements and you will know which one to choose. And there is no real good tear replacement. But if you are going to use any drops for a prolonged period of time, more than 4 times a day, try and consider to use a drop which is preservative-free. Thank you. It's a very short talk, and the idea is just to give a flash rather than go into detail and just to highlight the problem the ocular surface can give rise in people who are suffering from keratoconus. Thank you.